like to, let's see, we're recording as well, so people will see this in the future. I'm just trying to see Lisa and Marjorie. Let me just, here we go. Okay, it's 12:01. Is it okay to start, or do you want to wait a minute or two?
I think it's fine to start.
Great. Okay. So okay. So hello, everyone. Thank you so much for joining us today. The topic is expanding the concept of end-of-life care in long-term care. And this is a scoping review focused on exploring the role of personal support workers. We're so lucky today to have Danielle Just with us. She is one of our Institute for Life Course and Aging's collaborative students. And we're delighted. She's now in her third year and working under the supervision of Dr. Lisa Cranley, who's one of our affiliated faculty members in the Faculty of Nursing. Danielle's research examines the role of personal support workers in end-of-life care provided in long-term care homes. She holds a Master's of Health Leadership and Policy in Seniors Care from the University of British Columbia. So thank you so much today for joining us, Danielle, and we look forward to hearing more about your research.
Thank you. And hi, everyone. Thank you for attending virtually today. I'm going to be sharing both some of the findings from my scoping review that I conducted in my first and second year, as well as what that has led me to in my research project currently that I am starting the process for as a PhD student at the University of Toronto. So my research, as noted, is on personal support workers and specifically their role in end-of-life care in Ontario long-term care homes. My supervisor is Dr. Lisa Cranley, and my committee members are Dr. Hannah O'Rourke and Dr. Whitney Berta. And I'm in the Faculty of Nursing at the University of Toronto, doing the collaborative specialization with the Institute of Life Course and Aging. All right, so I probably won't take the full hour today, so there definitely will be time for questions or comments at the end of the presentation, but if anyone has any questions throughout, please feel free to just jump in. So just to give you a little brief background about myself, I am not a nurse by background. I'm a kinesiologist. I did my bachelor's in science with an honor specialization in kinesiology. And then I worked as a recreational therapist in long-term care before moving over to adult daycare programs in community settings. And then I went back to school to complete my master's in health leadership and policy, where I specifically focused on the long-term care system in Canada. During this time, I was still working part-time as a recreational therapist in long-term care and assisted living homes out in British Columbia, and then went on to work for the BC Care Providers, which is an organization that association for the private or for-profit homes in British Columbia, before coming back to Ontario to start my PhD, specifically looking at the role of personal support workers. So when I was working clinically in the long-term care setting as a recreational therapist and not a registered nurse, I worked quite closely with the personal support workers as they were transporting the residents to and from recreation, or helping with mobility with the residents who were maybe declining in their mobility. So I got to working with this group quite closely and seeing everything they do, and it really sparked an interest for me to continue in research and really explore their role. And then with the changing context of long-term care pre-COVID-19, I was really interested in personal support workers' role in end-of-life care and how integral they are to the end-of-life care or palliative care that's provided in this setting in Ontario and Canada abroad. So that's a little bit of background about me. And I kind of went over my primary research interests. So first, looking at the personal support worker, I'm really interested in their role in end-of-life care on the interprofessional team in long-term care. So research out there, the literature states that this role has not been clearly defined. And a lot of papers still note their role, so the personal support worker's role, as unclear. I also specifically looking at the long-term care context and wanted to put COVID-19 on here just because we've seen such a drastic change in long-term care over the past 8 to 10 months with the COVID-19 pandemic, and family members no longer being able to be in the long-term care homes, maybe as much as they were prior to COVID or as much as they would like. So this has really changed the role of personal support workers in long-term care. They've lost some of their support, some of their volunteers who are no longer able to enter the home, as well as the family members who would have been an integral part of that care team. Even though they weren't official part, personal support workers maybe really had to pick up the slack. So we're seeing early papers come out saying that their role really has changed drastically. And just a little bit of background, personal support workers, they are an unregulated profession. Sorry. They are an unregulated profession in Canada, so they do not have an official scope of practice that governs their role. However, there has been a lot of research about education, training, skills, knowledge for personal support workers, particularly around the palliative care, end-of-life care context. However, there is literature out there that says this alone won't support their role. There needs to be separate literature investigating their role and investigating what competencies they need and what is required of them. So Catherine Froggatt really led this, and she says that education alone is not enough to increase the quality of end-of-life care for personal support workers in long-term care. So we have to look at their role and what supports are available to them and what's really being asked of them or what they are doing in this role. So that's sort of where my research comes from. So in 2019, or started in 2018, but in 2019, when I was in my first and second year of the PhD program, I began writing my literature review, which really covered and went over all this background information. So I started to read through all of the literature and really scope out where I wanted to focus my research. So the purpose of my literature review was to explore personal support workers' experiences and perspectives of their role in end-of-life care and long-term care homes, with the objective of further expanding the concept of end-of-life care and identifying the gaps in the literature surrounding the role of personal support workers in end-of-life care. So with that first objective to really expand the concept of end-of-life care, I wanted to look at end-of-life care from the perspective of the personal support worker and what it meant to them to provide end-of-life care in the long-term care setting. So in order to do this, I had to look for a framework or a definition of end-of-life care. And I went to the nursing literature to do this. And Ruland and Moore developed this peaceful end-of-life theory. So it's a relational model that illustrates the 5 outcomes or domains of high quality life at death. And the 5 domains of end-of-life care, as defined by this theory, are not being in pain, experiencing comfort, experiencing dignity and respect, being at peace, and closeness to significant others or persons who care. So this is a middle range theory that was developed for nurses. I adjusted some of the competencies to personal support workers based on their education requirements for the province of Ontario. So some of the specific lower down competencies that drop down from it here that they may not be responsible for, such as facilitating medication, where they would just be reporting this to the nurse. So I did adapt this slightly for the personal support workers as it was developed for nurses, but it did align quite well because it was developed in this nursing literature and within this person-centered framework. So I took this model and I took those 5 overarching domains, which are not being in pain, experiencing comfort, experiencing dignity and respect, being at peace and closeness with significant others. And I applied this, I expanded this model to be applicable in the long-term care context by taking some of Dr. Whitney Burda's work, which states that the role of the personal support worker is evolving. So by taking these 5 domains, Dr. Burda says that the role is constantly evolving and that there is a role boundary between the in-role behaviors and the extra-role behaviors that personal support workers apply or do when they're at their workplace. So in my case, long-term care. So there are in-role behaviors, and these behaviors are as depicted or expected by the employer. So the employer in the long-term care setting details what is expected of the role of the personal support worker, whereas the extra role behaviors are roles where personal support workers went above and beyond their job description to provide end-of-life care to residents. So these were behaviors that are not detailed in their job description. They are not expected by the employer. However, the personal support worker felt that they were needed in order to provide the resident high-quality care at death or high-quality end-of-life care. So I looked through the literature. I looked at international literature. It came from mostly first world countries, as long-term care is really applicable only in first world countries. And I was able to find 15 articles that explored personal support workers' experiences or perspectives of their role in end-of-life care, and I applied it to this framework. Sorry. So this is the figure that I came up with, and I will go into detail a little bit. So the first one is not being in pain. So this was detailed as a domain of end-of-life care. As we can see, there are some extra role behaviors here. So personal support workers adapted the tempo of physical care. So this was above and beyond the job description of personal support workers. And then some in-role behaviors, personal support workers, these are the roles that were expected by the employer. Sorry, one second. Sorry, I have a 6-month-old golden retriever, so she doesn't always listen. And then I will come moving on to some of the other extra role behaviors. So experiencing of comfort, there were 2 extra role behaviors that were found for this domain. So personal support workers provided high, and it was deemed unstandardized level of physical care to dying residents. They also provided physical care to dying residents at a higher frequency than other residents. So this was not detailed in the job description as applied by the province of Ontario. However, personal support workers felt that dying residents needed care at a higher frequency, and therefore they would work with peers on their floor in order to provide this care. Moving on to experiencing of dignity and respect, personal support workers ensured residents did not die alone. They did this by either staying after their scheduled shift or not providing care to other residents, so in order for them to sit with the dying resident. Moving on to being at peace. So personal support workers, these were 2 of the most highly reported outcomes. They reported becoming emotionally involved with dying residents and acting or feeling as extended family to the dying residents. So in Ontario, the personal support worker competencies actually detail that personal support workers need to maintain a professional boundary and not extend into gaining emotional feelings for residents. However, when I looked at the literature, this was one of the highest reported outcomes for personal support workers. So that was one of my key findings from the scoping review. And for the last domain, closeness to significant others or persons who care. So personal support workers were requesting significant others to observe and report pain or discomfort. So what this means is personal support workers were asking family members who were present at the time to tell them when their loved one was in pain or discomfort. They reported being too busy or too overworked to sit and properly watch or care for and report these. So they asked them to first watch over, and then secondly, if they did feel that their loved one was in pain or in discomfort, the personal support workers stated in the interviews that they encouraged the family members to share these feelings with the RNs and to continuously share up to the registered nurses so that additional pain management could be provided for their loved one. So these were some of the key findings that came out of my literature review. And obviously I didn't go into the role required behaviors, but these were some of the most commonly reported behaviors by personal support workers that is detailed by their job description or outlined by their employer. So this is my literature review that was published late 2020. So it was published just in September in the fall, and it's expanding the concept of end-of-life care and long-term care, scoping review exploring the role of healthcare assistants. I use the term healthcare assistants just because this was an international journal, and healthcare assistants is more commonly used internationally. In Ontario, we typically use personal support workers or home health aides. Does anyone have any questions before I move on from that? Okay. Oops. So from my literature review, I found that more research is needed to further understand personal support workers' role in end-of-life care within the current context of Canadian long-term care homes. So I wrote this in pre-COVID. And today I would say that this is even more true. I think long-term care has changed throughout COVID, and that following the vaccination of Canadian citizens, we will need to do more and more research on long-term care. I think COVID's really highlighted the long-term care system. So I would stand by this statement and say that even more research needs to be done. And secondly, that the findings revealed significant gaps in the literature surrounding residents and family members' perspective of personal support workers' role in end-of-life care. So there was a lot that came out and showed that the residents and the family members, the residents and the personal support workers developed this emotional bond, and they feel like their family at the end of life, as they are the ones providing the end-of-life care. However, not a lot of research has really focused on that relationship or explored the residents' perspective of that relationship, which is something I hope to focus on in my research moving forward. Sorry. So the purpose of my research. So based on this literature review, I wrote my proposal for my PhD research project. And the purpose of my PhD research project is to understand personal support workers' role in end-of-life care in long-term care homes in Ontario, Canada. My aim of the study is to describe the role required and extra role behaviors in end-of-life care from the perspective of multiple stakeholders to construct an understanding of personal support workers' role within an Ontario long-term care home. So I first want to look at how personal support workers describe their role in end-of-life care, and I want to collect a lot more data on this specific to the Ontario context, just being from Ontario and currently studying in Ontario. And then I also want to gain the perspective of nursing staff, managers, administrators, family members, and residents. So I'm really looking to gain that holistic perspective of what is personal support workers' role in end-of-life care in the long-term care context. I think it's really important, specifically the resident and the family member. Not a lot of research to date has really explored this resident's perspective of end-of-life care and long-term care. And that's something that I hope to highlight specifically around that resident and personal support worker relationship and that emotional relationship that comes with providing end-of-life care. So prior to conducting this, I just did want to highlight for potentially other students in the audience is that I had to look for my researchers, my positionality and my philosophical approach is this will be a qualitative study. And I just sort of wanted to highlight this map that I used, and this map came out of a course that I did with the Institute of Aging, and it's called the Social Identity Map. It was developed at U of T by two master's students, I believe, and they developed this as a way for researchers to explore their positionality and how they are situated for conducting qualitative research. I found it extremely helpful. It really, as a novice researcher and conducting qualitative research for the first time leading a research project, I really found this helped and aligned me well with what was important. So I'm happy to share the link at the end or in the chat, but it was developed by Jacobson and Mustafa in 2019, and they were master's students at the University of Toronto at the time. So I just wanted to share that with everyone. And then for my research project, I will be using this conceptual framework. So this is the framework that came out of my literature review, and I've named it the Role-Behaviour framework. So in my research project, this was the same sort of graphic that I used to describe my findings in my scoping review. And I'll be taking this framework and applying it to my research project as I move forward in order to explore all the different stakeholders' perspectives and experiences of personal support workers' role in end-of-life care. And then to go on to just some of the methods that I will be using. So I was writing this proposal during COVID. So COVID was a key consideration when I was thinking about doing my research proposal and thinking about the way I was going to be collecting data. So I'm doing a qualitative descriptive single case study research design. So I'm doing a single case study and I'll be using qualitative research methodology in order to conduct my study. This is all based on Yin's methodology. So for me, the case will be defined as a long-term care home. And then the central phenomenon within that case that I will be exploring is personal support workers' role in end-of-life care. This case study will be 100% virtual, so I will be doing the research from my home through Zoom and other video platforms, as well as the telephone, and reviewing documentation data virtually. The reason for virtual was due to COVID and limitations into entering the home and conducting research. And I took a lot of these virtual methodologies from historical case studies. So in historical case studies, the researcher is not able to enter the site or where the case is located. And so I took some of that and I transferred it to a virtual case study where I am not able to enter the site. So I took some of the same data collection methods from that methodology. So for my setting, so as I'm only doing one case study instead of multiple case study, the purpose of this is to describe the common case in Ontario. And then based on reviewing the Ontario long-term care context, I came to note that the common case in Ontario is a medium long-term care home that is private. The majority of long-term care homes are accredited by Accreditations Canada and operate in good standing. That's why I have these two inclusion criteria. As my primary language is English, the long-term care home must also use English as their primary language for feasibility. And the long-term care home must employ personal support workers to provide direct care to residents. So some homes in Ontario employ RPNs or RNs to provide direct care and don't actually have personal support workers. And for the purpose of my study, I will need personal support workers employed. Some of the exclusion criteria that I will be applying is that the long-term care home must not have received assistance from the Canadian Armed Forces in the past 12 months, just because their care practices might be altered by this or maybe slightly different, as well as no long-term care homes with religious affiliations. And the reason for this is that some long-term care homes with religious affiliations have different end-of-life care practices and therefore wouldn't represent the common long-term care home in Ontario, which is the purpose of my single case study design. So study participants. So as I noted a few slides ago, I will be taking interviews with multiple stakeholders, starting with the resident, family member, personal support worker, RN nursing staff, and including RPNs, moving up to administrators and managers at the long-term care home. So really hoping to collect a holistic understanding of personal support workers' role in long-term care. So for personal support workers, this is some of my inclusion exclusion criteria. So understand and speak English, provide direct care to residents, and currently employed by the study site for 6 months or longer. The reason for the 6 months or longer is that the literature details that end-of-life care is provided in the last 6 months of life. Therefore, I'm hoping to interview staff who've been employed at the home for 6 months or longer. Similar sort of inclusion criteria as we move up to RPNs and RNs, as well as managers and administrators at the long-term care home. So looking at the directors of care or the assistant directors of care. And then moving up to my residents and family members. So I am hoping to recruit residents to conduct interviews. The interviews with the residents will be shorter in duration and have less questions in order to not be burdensome for the residents. For my inclusion criteria for the residents, I'm hoping that they will be able to understand and speak English, can provide informed consent. So although the majority of residents in Canada do have dementia or some form of cognitive impairment, I will be requiring that the residents who I interview are able to provide informed consent to participate in my study. Are they age 65 years or older and have been at the home for the last 6 months. And then I'm also requiring them that they have a family member who's participating in the study. The reason for this is to facilitate the interview. So since I won't be actually at the site, I'm hoping that the family member, that COVID restrictions are slightly different and that the family member is able to go in and facilitate the virtual interview if it is over the phone or through Zoom or some form of virtual video conference call. And then no residents who have elected medical assistance in dying, just due to the fact that their end-of-life care may be slightly different due to this medical choice. And then for family members, they must be 18 years old or older, and the individuals who are actively involved in the life of a resident living at the study site. They can be an informal caregiver, friend, neighbor, relative of the resident. So using the very broad definition of family member, which is also used by Health Canada to describe a family member of a long-term care resident. And then just moving through for data collection. So as I noted, it will be a virtual data collection. However, I will be collecting information on the study site, so setting characteristics in order to develop a contextual description of the study site. I'll also be collecting documentation data of the study site in order to develop a more holistic understanding of the case, which is the long-term care home. So I'm hoping to gain access to policy documents, staff training materials, staff memos, as well as any media or photographs that may depict the role of personal support workers' end-of-life care. For these two documentation forms, I will also be asking the study participants whom I interview if they have any forms of photographs or media that they would like to share in order to describe further the role of personal support workers. And then I will be doing interviews, as noted, over telephone or video, as well as collecting field notes during these interviews in order to gain more data. And the purpose of this is really to gain an in-depth understanding of the central phenomenon, which is personal support workers' role in end-of-life care. So following the interviews, I will be offering a debriefing session with the opportunity for them to share their documentation data, so their photographs or media, as well as go through the key takeaways of the interview and give them the opportunity to provide any further clarification or any additional points. So data management will be using NVivo, and all of my data virtually will be stored on an encrypted USB. My data analysis, so using Yin's descriptive framework data analysis strategy, I will be applying my role behavior framework from my scoping review and using thematic analysis to describe the role of the personal support worker in end-of-life care. I'm hoping to describe this role from each stakeholder group, so from the personal support workers, the nursing staff, the family member, and the residents, and see if there's any rival expectations or rival points from the different stakeholder groups. So seeing if family members and residents see the role of the personal support worker differently than nursing staff or vice versa, as well as seeing how the personal support workers' perspective, their role differs from how family members view their role in end-of-life care. So really taking that framework and sort of stacking it on itself and see where they're similar and dissimilar to maybe explain some of the misalignments and understanding of their role in clinical practice as well as in the literature. So just to go over some last key points in case anyone is interested for trustworthiness, I will be gaining multiple forms of data as well as collecting a thick description of the data and those converging lines of inquiry from the different study participants. I'll also be keeping a clear audit trail of all of my data collection methods that I do over the study, and then some potential limitations of my study. So the COVID-19 pandemic, while we are hopefully nearing the end in the past 6 months, there's no ways of knowing how long this will impact the long-term care setting. Virtual case studies, so the methods were taken from historical case studies. However, this does limit as I am not able to do any observations of the study site or observations of the study participants, which is typically a key form of data collection in case study research. There are limitations with video and telephone interviews, as we all know, over internet connections, video connections, study participants feeling comfortable sharing over the phone. There are some limitations associated with this form of data collection. And finally, no patient observation. Sorry, study participant observation. So some of my anticipated outcomes, just to wrap up my presentation. So The application of this single case study design will reveal foundational knowledge on the integral role of personal support workers in end-of-life care and long-term care homes, and hopefully provide information to inform clinical practice guidelines and nursing education specific to the long-term care context. And to the best of my knowledge, this will be the first study or research project that explores personal support workers' role in end-of-life care from the perspective of both personal support workers and the residents in long-term care. And that is the end of my presentation. If anyone has any questions or comments or...
Thank you so much, Danielle. That was very interesting. And I have to say my very first job was as a personal support worker. So I'm very interested and I have tons of questions myself. But please, I know we've got a really interesting group of people with lots of different experiences. So please unmute, describe who you are, and ask any questions that you have.
Hi, I'm Marjorie Davis-Williams. I'm just curious. I was really glad to see the researcher's positionality and philosophical approach in your presentation. Do you anticipate that you would have any concerns around bracketing some of the identified areas of your positionality?
Yeah, so I don't know if I have any concerns. I think it's just important to note it and be aware that that's the position I come from. There are, I guess you could say positives and negatives. For speaking to personal support workers, I wasn't a nurse, but I did work in that area, so I understand sort of the power dynamics between coming in and talking to personal support workers as someone from a higher education institution or research. I've done a bit of reading on that, so I think that framework really helped me just become aware of my positionality and my researcher bias and where I stand and how I approach questions. I am coming at the study under a constructivist sort of philosophical paradigm, so constructing knowledge with the study participants on the role of personal support workers. So under that philosophical paradigm, it does sort of bring in my approach. I'm not a silent participant, just sort of observing, and I'm really working with the study participants to construct knowledge. But it is something that I'm aware of, specifically with the different power dynamics in long-term care.
Thank you so much, Danielle.
Yeah.
Anyone else want to comment or ask a question?
Hi, my name is Ronnie Burbank. I wanted to thank you and congratulate you for your study. I am retired and at home now, and a virtual long-term care and hospice volunteer and former family member in both. And I think you've picked an excellent study proposal and are approaching it in a really an excellent fashion. And given pandemic times, I wish you all the best for conducting your study. I think it will be very, very important for everyone involved in care.
Yeah.
So thank you very much.
Thank you. Yeah, that's really nice to hear, and thank you.
Thanks, Marjorie. Thanks, Ronnie. Anyone else have any other comments?
Hi, it's Lisa. I just want to say great presentation, Danielle, and you've probably had enough questions for me over the last few years, but I agree. I think this research really is going to make a really significant contribution, so I'm really happy to see that you're doing this work.
So I just had a couple of things. One is I thought starting with a scoping review was wonderful, and congratulations on getting it published. I've enjoyed your whole presentation. I just wondered, and I may have missed it in the presentation, did staffing levels come up as an issue? Because to me, the amount of time a personal support worker has to spend with someone who is dying is contingent on how crazy their schedule is to a large extent. So I heard you say they felt a little stressed about it, but were the reporting people who reported, did they actually say what the patient to personal support work ratio was? And did they also describe, were there differences across, was it all your studies in Canada, or were they all over the place?
Yeah, so the studies in my scoping review were from all over. I think there were 12 countries. So Canada, the US, New Zealand, the UK, all of, these first world countries. I think there were a few European countries as well. And they all did report that the staffing levels, so that they always report that as a barrier. So when I started to do my literature review, a lot of papers at that time were being published on the barriers and facilitators to providing end-of-life care and long-term care, which is where I started. That's what I thought I was going to write a paper on. And when I did the work, there was so many papers being published on that, and staffing ratios and resources were the top two barriers. And I think I found 12 publications that cited that. So I did cover that, I guess, in the background of my literature review. So that definitely is cited as one of the barriers to providing end-of-life care. However, maybe COVID will change long-term care, but at the time it didn't really seem like the structure, the organizational structure was changing. So when I looked specifically to the role of the personal support workers, they really came out and saying, they're staying after their shift, they're rushing through other residents' care because they're so stretched for time. Their staffing ratios, I think every publication cited that they're too low. And that was then causing this effect in their role. So now their role, they're rushing through residents who weren't dying care, or they were leaving that all to one person so they could sit with this dying resident. And it really did come through in their role, which is when I go to write my proposal and doing this case study is kind of why I came to doing a case study, because I have to look at the home, the organizational context, how many staffing members they do have, the ratios, that will all play. And that will all impact the role of the personal support worker. So really looking at that case study approach to be able to describe the ratios and the staffing model and organizational structures that impacted their role. Is that sort of how that came to fruition.
Great. Also, we had one of the graduates of the Institute for Life Course and Aging collaborative specialization was a woman named Julie Durgal from social work in 2011, and she was looking at personal support work, but hired by the families. Mm-hmm. So my understanding from what you presented, you're particularly interested in those that are that are paid for by the long-term care home. But that might be something to consider, because some of these homes, I mean, not necessarily now in COVID, but in general, some of these homes also have a lot of personal support workers that are hired by the families as well, and are playing some of that end of life role.
Mm-hmm. No, I think that's I think that's something I need to note and consider, because currently my study proposal is written to look at just the personal support workers hired by the home and employed, but you're totally correct that there will be other personal support workers there that are hired from external companies at the time, and they may impact the role whether or not a resident has additional help or not. So I'll definitely add that to my things.
Great. And then just because of the nature of COVID, sometimes the deaths are much faster than they had been historically. So if you're dying of cancer and it's a matter of weeks of decline versus mm-hmm. if you're rushed off to hospital perhaps quickly. So just think those are also things to consider. It's a moving target. I can only imagine trying to figure out how to do research in long-term care at the moment, and thumbs up for you figuring it out. But those may the variation in the speed at which people die in this context might be quite mm-hmm. influential to what you're researching.
Yeah, I think you're right. And I think that's, we've seen that time and time again. The death rates in long-term care are unfortunately so high right now. And I have looked at the different death trajectories of the different, cancer versus heart attack and everything. And so I will hope to just, and I think I'm hoping to recruit about 6 to 8 residents. So in my case study, and I just really hoping to highlight their voice, but I agree that I have a long list of challenges. So that is a hope, it's, if it doesn't come with COVID or something, then we'll just go with the family members and hopefully they can speak, but I'm really hoping to highlight that resident's voice, but I think that's something I should also look into as COVID's impacted them.
Well done. And I do think most people have not included the voice of the personal support worker nor the voice of the dying patient. So congratulations, kudos on doing that. Great.
Thank you.
Any other comments, questions? One thing that we'd love you to do is fill out the evaluation form. This is something that we give to Danielle. Susan's already just put it in the chat. We give to Danielle, and when she's putting together her package about her teaching skills, this is helpful for her to have, because when she goes job hunting, this is one thing that they look for. So I know people are rushed for time, but it would be a good service to Danielle if you can just spend even 2 or 3 minutes filling it out. Would be great. Thank you.
Thank you so much.
And there's some comments coming up from Nadine on congratulations on your research. Well done and so needed. So generally, you heard we're very pleased and excited about what you're doing. And we're hoping when you've written it up that we can have you back and present the findings. So
yeah, no, definitely. And thank you everyone for spending your lunch hour and hearing my presentation. So it's great.
Thank you.
Thanks, Danielle.
Have a good month.
Bye.
Right. Take care.
Bye.
Bye.